A decade ago, less than 30% of women knew that heart disease is the #1 killer of women. Well, today, this awareness has improved, but for far too many women with heart disease, the care they receive has not. One organization is determined to save more women's lives by ensuring they receive the best care available. WomenHeart, the National Coalition for Women with Heart Disease, is the only voice for the 41 million women living with or at risk for heart disease. Women like Cindy DeMarco.
I'll never forget that day in June of 2000. I woke up with crushing pain in my chest, upper back pain, tingling down the sides of my arm and in my jaw. I was nauseous, and I couldn't understand what was going on with me. I was 30 years old. I was a captain in the Army. I was in the best shape of my life. I thought, suck it up. That's the Army motto. Just keep going. But after 12 hours, I couldn't take it anymore. I went to the emergency room, and they weren't too concerned about my symptoms. I explained them, but they weren't concerned. I saw a doctor, and he said, well, you're probably doing too much. We're going to give you some muscle relaxers and send you home. And there was a guy next to me who was having chest pain, just like me, and he was hooked up to an EKG. I had to ask to be hooked up to an EKG, and when I was, all hell broke loose, and they told me I was having a heart attack, and I couldn't believe it. I was shocked.
After her heart attack, Cindy had to continue to be her own advocate for proper treatment, which led her to WomenHeart.
My doctors told me that they weren't going to send me to cardiac rehab because I was otherwise healthy and young, but I demanded to go. And once I got there, I met a wonderful cardiac rehab nurse who introduced me to WomenHeart. Joining WomenHeart was such a cathartic experience for me. WomenHeart educated me. Now I'm out there educating other women about heart disease, because I don't want what happened to me to happen to any other woman.
The disparities in care that Cindy experienced almost 10 years ago still exist today. Women like Cindy are more likely to experience delays in emergency medical services and are more likely to die. Recent studies show that women heart patients are less likely than men to be treated according to established medical guidelines or to receive adequate focus in medical research.
Disparities exist in healthcare for women on multiple levels, but particularly in heart care. For instance, women suffering a heart attack in the middle of the heart attack are far less likely to get all of the guideline-based drugs that they're supposed to get. And that even includes aspirin, which is cheap and doesn't require prescription.
Our efforts at FDA are improved and are further advanced really only because of groups like WomenHeart, who advocate for heart health for women, who advocate for health policy for women and heart disease, and who empower women to participate in clinical studies.
By educating women about heart disease in local communities and through the media, WomenHeart and its army of volunteers nationwide are helping women take charge of their heart health and demand appropriate care.
When you look at the number of women living with or at risk for heart disease at 41 million women, you realize that we have only begun to fight.
Heart disease in women, even young women, is not uncommon and takes a terrible toll. Now a compelling wake-up call for women of all ages is being delivered by those who know best.
Nearly 500,000 women die of heart disease every year, so the Mayo Clinic and a group called WomenHeart are training an army of messengers.
This is what an angiogram looks like.
Giving these survivors a look at the medical equipment that saved their lives. These women are also learning to use the most powerful weapon they have against heart disease, their personal stories.
When I went to the emergency room, I knew something was wrong. I sensed it. I knew it. There is a discrepancy in the care and the aggressiveness of the care that women receive.
We partnered with Cheerios to run the Cheerios Circle of Helping Hearts tour to provide cholesterol screenings to women in low-income neighborhoods, people that would not have otherwise been able to get their cholesterol screened, and the response was phenomenal.
Lo vi como una buena oportunidad, ya que realmente pues estoy necesitada de este análisis.
In its first 10 years, WomenHeart has helped raise national awareness about the importance of women's heart health. But much work remains to be done to decrease disparities in heart health care and improve care for women. In the next decade, WomenHeart and its champions will continue to educate, advocate, and when they need to, fight to guarantee prevention and early detection, accurate diagnosis, and proper treatment for all women.